Let's talk about blood disorders. There's a blood disorder right there. Do you know what that one is? We'll identify it later. So let's jump right into hypoproteinemia. There's one of those words you ought to be able to figure out what it means even if you've never seen it before. Hypo, less than or not enough. Protein, we know what those are. Emia, in the blood. Hypoproteinemia, not enough protein in the blood. So low levels of protein in the blood. Why would that happen? Well, extreme starvation. If you're not eating, then you're not getting proteins. You're not getting amino acids, therefore you can't make new proteins and so on. Diet severely deficient in protein. Some people, there's some weird diets like the frugarians or whatever. I know people who only eat fruit. Not a lot of protein in fruit. That can happen in those cases. Liver diseases interfering with protein synthesis. Remember, the liver is the plasma protein factory of your body. It made most of those 300 plus proteins in the blood. So if your liver is not working effectively, you can't make those proteins. Kidney disease, it permits proteins to leak out of the blood and into the urine. You would end up with proteinuria. That's a sign of kidney failure or kidney disease. Severe burns, proteins escape in the exudate, so people who are severely burned, they're oozing stuff and proteins are in that. Sepsis, so here's where bacteria, for example, can cause, that we talked about septic shock. You get into organ failure and so on. So what happens as a result of hypoproteinemia? Well, there's not enough osmotic pressure in the blood. Remember, we've been talking about this. I told you this is an important topic, and here we go. If there aren't enough proteins in your blood, there's not enough osmotic pressure. Remember, water follows solutes. So what's going to happen? You won't be able to pull enough water into your blood. Therefore, where is the water going to go? Well, what kind of fluid is right outside of your blood vessel? That would be ISF, right? So that means there's going to be an increase of ISF. And what do we call an increase of ISF? That would be edema. So blood doesn't attract water as much. Water diffuses into the interstitial spaces between cells, and we end up with edema, which is excess fluid in the interstitial spaces. So ascites in particular is the name for excess fluid in the peritoneal cavity. Now, think about your torso, your abdominal cavity, your thoracic cavity, your abdominal cavity especially here in the peritoneal cavity. That's where you've got a lot of big organs. You know, your liver, your intestines, your stomach, and so on. There are a lot of big blood vessels there, all right? Splenic artery, the common hepatic artery, and so on. So what that means is you're going to have a lot of the effect of hypoproteinemia within that peritoneal cavity, and therefore you're going to leak a lot of fluid into the ISF. And the ascites then is a common place for people to have edema as a result of hypoproteinemia. So, for example, kwashiorkor. This is malnutrition caused by severe hypoproteinemia. Name comes from the language of Ghana, means the sickness the baby gets when the new baby comes. So think about it. Here's a problem. You've got a lot of sub-Saharan African countries. There's not good birth control. Mom has a baby, she's breastfeeding it, and then mom has another baby. Well, the new baby needs the breast milk more than the other baby. So the new baby gets the breast milk, and the older baby now gets put on some sort of another diet. And because of a lot of the lack of protein in a lot of those areas, they get put on a mostly plant-based diet. They don't have enough protein in their diet, and they end up with what's called kwashiorkor. They end up with ascites. They end up with edema in the peritoneal cavity. New child is born. The older child no longer allowed to nurse. Typically switch to a high-carb, low-protein diet. Signs and symptoms of this: edema, most notably ascites, enlarged liver. All right, what's happened when the liver can't get enough raw materials, amino acids, to make proteins? This is a natural response in your body. We're going to see this in a few other organs as well. This is what we see with a goiter, for example. Your body will think, well, gosh, if we're not making enough proteins to the liver, let's make the liver larger. Maybe that'll help. It won't, of course. The problem is ultimately the lack of protein, but your body doesn't know that, and so sometimes organs will become enlarged when they're not functioning correctly. Loss of hair and teeth because you need proteins to make that. Ulcerations of the skin, you need proteins to repair the skin. Muscle wasting. So you see those kids in the picture, this is just tragic. I'm sure you've seen kids like this in other pictures before. Those kids with those big swollen bellies, that's not because they've had a lot of food. That's ascites. That's edema of the peritoneal cavity. Look at the arms of those kids. See how they're nothing but, literally nothing but skin and bone? They have used up their own muscles in order to try to provide themselves with protein. Such an incredibly sad situation. Another side effect of this is that they're not, since they're developing, their brains are growing. This means they're not making enough proteins to supply what's needed in their brain. These kids may suffer mental retardation as a result of this. It's just such a sad, sad situation. God, every little kid on planet Earth should have enough food to eat. I mean, that seems like something we should be able to do as a planet. All right, so some erythrocyte disorders. Erythrocyte, red blood cell, right? Anemia. Anemia is extremely common. Now watch out. You probably think you already know what anemia is. What you may not know is there are many, many kinds of anemia. So make sure to get these straightened out and don't get them mixed up. So anemia means the blood has abnormally low oxygen carrying capacity. Now look at, that's a technical definition, and you're going to get fooled because you think anemia means something else. It doesn't. Anemia means you can't transport enough oxygen, all right? That's the definition of anemia. Sign rather than a disease itself. Blood oxygen levels cannot support normal metabolism. So what happens? If you don't have enough oxygen, you're fatigued, you turn pale, because remember, it's the binding of oxygen to hemoglobin that makes the red color. Shortness of breath, because you're trying to get more oxygen into your body. Chills. Picas are interesting. Pica is a craving for a non-nutritive substance. One of the most common ones is anemia, is they'll eat ice chips. It's just like a craving to chew on stuff, even though it's not giving you any nutritional value. That's called a pica. So could you have a normal hematocrit but still be anemic? All right, remember hematocrit is the proportion of red blood cells in the blood. Could your hematocrit be normal but you still have anemia? I want you to think about that. I want you to think about if that's possible. So causes of anemia, insufficient erythrocytes. That's the one that occurs to people most naturally. You don't have enough red blood cells, therefore you don't get enough oxygen carrying capacity in the blood. Hemorrhagic anemia, so acute or chronic loss of blood, that's going to happen whenever you're bleeding. So could be like from an injury, from some sort of trauma, or it could be from an internal condition where you're bleeding internally, all right? Hemolytic anemia, red blood cells rupture prematurely. This can be caused by lots of things. Toxins, blood transfusions, if you get the wrong type of blood. Malaria will do this, vitamin E deficiency, marathon runners, all right? All that bouncing around is actually tough. Remember, red blood cells are just barely narrow enough to make it through a capillary. And heavy, stressful activity can cause the red blood cells to get roughed up more. They burst, and then you don't get enough oxygen carrying capacity. Aplastic anemia, that's destruction or inhibition of red bone marrow, can be caused by bone marrow cancer, also by people getting radiation treatments, as well as toxins. So, this is why, like, my wife had cancer, undergoing radiation treatment. She ended up with not enough red blood cells. That's anemia, all right? And it was due specifically to her treatment. That's why, I think I mentioned this before, she would get transfusions, not of whole blood, but of packed red cells, all right? More causes of anemia, low hemoglobin content. So if you have an iron deficiency, remember hemoglobin has that iron group, that heme group at the center with the iron atom that grabs the oxygen. If you don't have enough iron in your diet, you end up anemic, all right? Secondary result of hemorrhagic anemia as well. Inadequate intake of iron-containing foods can be one reason. Impaired iron absorption is another possibility here. And in fact, pernicious anemia is a deficiency of vitamin B12. So lack of intrinsic factor is needed for the absorption of B12. Vitamin B12 is needed for cell division, all right, all through your body. But because red blood cells, remember, only live 90 to 120 days, you're making a lot of new red blood cells all the time. So when you lack intrinsic factor and you lack vitamin B12, one of the first places that's going to show up is in terms of your red blood cells, and that's going to be then what's called pernicious anemia, all right? Treated by intramuscular injection of vitamin B12 or application of cyanocobalamin, which they actually have a nasal spray, vitamin B12, so you can absorb it that way. I had a woman in my class a few semesters back who had pernicious anemia, and she at that point was going in periodically for injections of vitamin B12. They do it just like a shot, just in the deltoid muscle. She would have to go in, I don't remember how often, but she would get injections of vitamin B12 so that she could absorb the iron, the vitamin B12, so she could absorb the iron, all right, and then that was able to keep her anemia under control so that she didn't have the anemia. More causes of anemia. Abnormal hemoglobin. So thalassemias. These are an absent or faulty globin chain. Their red blood cells are thin, delicate, deficient in hemoglobin. Found in primarily the Mediterranean regions. It's just one of those things. It's in the gene pool there. So funny, a few years back I was at a cocktail party, which I despise those. But I was in a little group of people talking, and there was another little group of people behind me. And I heard a woman, she was actually a pediatric hematologist in New York City. She worked with kids who had blood disorders. Now you couldn't get a job like that in Eureka, Kansas, because there wouldn't be enough kids that would qualify. But in New York City, high immigrant population, she actually had a whole practice of just treating kids with blood disorders. And I heard her mention thalassemia, and somebody in her little conversation group said, "What's thalassemia?" And I turned around and explained exactly what it was, and I went back to my little conversation group. And I saw this woman, she was a physician again, and I saw her a little later. I was getting wine, and she came up to me and said, "Who are you?" I said, "Wouldn't you like to know?" Sickle cell anemia, similar to thalassemias in a lot of ways. Sorry, I went past that. Sickle cell anemia, we'll talk more about that in a moment. So a patient with low iron levels would experience which of the following symptoms? Increased hematocrit, decreased white blood cell count, decreased white blood cell count, increased energy, or decreased energy. Yeah, low iron means not enough hemoglobin, means not enough oxygen in the blood, therefore you're going to be fatigued. You're going to be drained of energy all the time. When my wife was going through chemotherapy and stuff for her cancer, she was so anemic in spite of the transfusions that just walking across a room, she would have to stop like halfway across the room and rest. She was out of breath. And I remember taking her to her treatments. I saw other people the same thing. I saw a guy trying to get from his car into the clinic, and he had to keep stopping and resting on other people's cars along the way. And I went over to help him, and he said, "No," he said, "I'm okay." He said, "I'm just totally out of gas. I just can't even walk more than 2 car lengths, and I'm so tired I can't walk any further." That's typical of severe anemia. So sickle cell anemia, this is where there's an old farm instrument called a sickle, and it's shaped kind of like that blood cell right there. It's used for cutting grass, cutting weeds, whatever. This is a defective gene that codes for abnormal hemoglobin. So sickle cell anemia is homozygous. Sickle cell trait is heterozygous. You should know what that means. I'm pretty sure they cover that in Bio 156. So in other words, if you have one bad gene for hemoglobin, you're homozygous. If you have 2, you're heterozygous. I said that backwards. So if you have 2 bad genes, you're homozygous. If you have 1 bad gene, you're heterozygous. Clearly, sickle cell anemia is more dangerous because you have both bad genes. Sickle cell trait, not nearly as bad because at least you have some normal hemoglobin and some abnormal. Causes red blood cells to become sickle-shaped in low oxygen situations. And why would this persist in the gene pool if this is dangerous? Well, in sub-Saharan Africa, this confers resistance to malaria. Sickle cells are more difficult for malaria to invade, So that's why it stays alive in the gene pool. 1 out of 500 black newborn babies in the United States have sickle cell trait or sickle cell anemia. And there you see, it's amino acid number 6. It's a valine instead of a glutamate, right? And that's all that it takes. One difference of amino acid, and now you don't have a normal red blood cell, can't carry oxygen like it should. And there you see an actual slide of blood. You can see lots of normal red blood cells, but then there are some of the sickle-shaped red blood cells. That might be sickle cell anemia, sickle cell trait. Again, it's just a matter of whether it's all defective or whether some of it's defective.